Hello, and welcome back to the channel. In this video, I wanted to discuss the fact that right now, some companies are basically saying that if you don't do what they are asking you to do, that you just might not have a job. So it basically boils down to no jab, no job. So before I get into this, I want to let you listen to some of the reasoning behind this. Some companies have basically outlined why they are saying this. It's for a couple of different reasons, a number of different reasons. It's not just one, okay? Because at first, they were offering incentives. They were saying, okay, if you get the jab, this is the direction that we are going to go. You're going to keep your employment, but we're going to keep our employees and our staff safe if you get the jab. And we will give you this as an incentive. But now they're doing a counter approach where they're saying, okay, if you don't get it, this is what's going to happen. We're going to take something away from you, something that you value, which is your money. Okay? So anyway, I'm going to let you go ahead and take a listen at this audio, and I will be right back.
Employers are beginning to tack on a special surcharge of $20 to $50 a month to their unvaccinated workers, according to one of the nation's largest health benefits consultancies. To date, employers have offered gift cards, a day off from work, cash, and other financial incentives to convince their workers to get vaccinated against COVID-19. But the carrot approach is about to be joined by a stick that could cost employees up to $50 a month, according to Mercer, the large employee benefits consultancy that works with thousands of employers around the world. Employers have tried encouraging employees to get vaccinated through offering incentives like paid time off and cash, but with the Delta variant driving up infections and hospitalizations throughout the country, at the same time that vaccination rates have stalled, we have received inquiries from at least 20 employers over the past few weeks who are giving consideration to adding health coverage surcharges for the unvaccinated as a way to drive up vaccination rates in their workforce, said Wade Simons, Mercer's Regulatory Resources Group leader. Mercer isn't disclosing the names of companies working on the surcharges, but said the amount of the surcharge being discussed with these employers is akin to the $20 to $50 a month charges companies already charge workers who smoke. Aside from a public health reason to encourage vaccination and keep workers and their families healthy, there is also a financial reason. COVID-19 can lead to serious illness and an expensive hospital stay that costs the worker and company-paid insurance, triggering premium increases as well. More for you. Did COVID-19 vaccines cause coronavirus Delta variants? Here's what the timing says. Joe Rogan rants against COVID-19 vaccine passports requirements. Delta variant waves trajectory bodes poorly for the U.S. An essay in last week's New York Times outlines several examples of how COVID-19 can lead to higher costs and health insurance premiums from the unvaccinated. Getting hospitalized with COVID-19 in the United States typically generates huge bills, Dr. Elizabeth Rosenthal and Stanford University's Glenn Croman wrote, citing examples that included a $104,000 bill for a 14-day hospitalization in Miami for an uninsured person. Though premium surcharges are only beginning to be considered, financial incentives are already being used by some employers. Mercer data from a survey in the last month of more than 300 employers shows only 10% provide a financial incentive, although 19% offer extra paid time off as a reward, Mercer said in a statement. Some employers are now offering additional time off so employees can assist with their children's vaccinations. Benefits consultants see the push by employers to get their workers vaccinated is only intensifying as employees return to the office after 18 months of working remotely. This past week, a few big names, including Google and Facebook, announced plans to require all employees to get vaccinated for COVID-19 before returning to the office, Mercer Simons wrote in a column last week on the benefits firm's website. And, while many employers are willing to take additional measures to increase vaccine levels, most employers continue to hold off on mandates because of potential employee relations issues that such a move might provoke. Now, with the Delta variant driving up infections and hospitalizations throughout the country, at the same time that vaccination rates have stalled, Health coverage surcharges for the unvaccinated are a tactic employers are reviewing as an alternative to a mandate.
Okay, so you have just heard the report on this, and that employers are now saying that if you don't get the jab, you won't have a job. And so that's going to put a lot of people in a very, very peculiar situation. So some decisions have to be made, right? A lot of people have already made the choice to either keep their job or walk away. Those who walked away, they decided that they just didn't want to take the risk. They weren't willing to take the risk because they are just not sure. So we can say all we want that this is not legal, but it has been stated that these private companies or these private organizations have the right to take your job if you don't take the jab. So that's what it's come down to. So this is just the beginning of all of this. We're going to start seeing where more and more decisions are going to be made where if you don't take the jab, you won't be able to buy or sell. And so this is not a time for us to fear, but it's a time for us to put on our thinking caps. Time to put on our thinking caps. We've been stating some of these things for many years about preparation. Preparation is more than just knowing what's happening, okay? You have to put your hand to the plow. You have to make moves, strategic moves, about what you're going to do with your life, what you're going to do for your family. How are you going to fortify your situation and strengthen what's going on in your own individual life, okay? I know this stuff may sound frightening to some, but it's not for us to fear, but it's for us to put on our thinking caps and make some decisions, okay? Right now, it's no jab, no job. What if the next phase brings us into so many things that many of us need, such as, and I'm going to just say this one right here, what if they say, if you don't get the jab, you can't renew your license? Okay? That's a whole other layer to this. Or if you don't get the jab, you can no longer come into the store. You don't get the jab, you can't get no gas. Is that the direction we're headed in? If that is the direction we're headed in, that says that we've got to figure out how to fortify at home as best as we can. And what if there is no end to the no jab rule if it's ever established with such strength? What if there's no end to it? Meaning they're going to wait for you to hold out, or they're going to force you to come out of hiding or come out of the no jab decision and say, okay, just so that I can function in society, I will take the jab. What if that's where we're headed? A lot of people right now, they're saying, look, I'm not taking it because I just don't know. A lot of people have taken it because they need their job. And so, again, this is really, really something. It's really something that we've never faced before. We have never, ever faced anything like this before. Now, some people are trying to compare it to things of the past, but there is nothing in the past that compares to what we are experiencing right now. Nothing. There's not one thing from the past that compares to this. Okay? Of course, people are making the decisions and the choices that they want to make based on what's going on in their own individual lives. There's talk about people getting COVID even after having the vaccine. There's talk about those that are unvaccinated getting more sick in this time. There's talk about those getting the jab actually passing it on. I mean, there's so much that's being talked about right now. Some people are afraid and some are confused, right? But then some people are not swayed in their decision to just wait this thing out to make a determination on whether or not they feel that it's safe. So whatever your thinking is on this, in all thy ways acknowledge the Most High, and he shall direct your path. But again, this is about the no jab, no job. A lot of people are facing some very, very tough choices right now because of this. They don't know what direction to turn. They don't know what to do. right? And like I said, regardless to what side of this you are on, just know that coming real soon, everyone is going to have a choice to make in regards to this, right? We see a lot of companies just basically. Now, I would like to say this. Some companies are experiencing situations to where they're not wanting to make it mandatory because they are already understaffed. We talked to one individual who said that one company, they lost a huge percentage of staff when they made it mandatory. Okay. And so many people walked out because they said, look, I'm not going to do this, right? They walked out. And so this company is struggling now to keep employees, or they're struggling because they're shorthanded. And those who are coming, those who they want to come aboard, not wanting to get this, is causing some issues in that company. So that has made other companies, and this is what the individual that we spoke to told us, that have made other companies step back and say, you know, I'm not sure I want to make this mandatory because we are already short-staffed. And if we make this decision, we just might be putting ourselves in a very awkward situation, being already understaffed, and then having people say, I don't want the jab, so I'm going to walk off the job. I'm not going to keep the job. You see? So, and not to mention, we forgot about this part. Well, we didn't forget, but I want to mention this part. There are companies right now that are having a hard time even hiring because people have gotten so comfortable with what the system is doing, basically saying, look, we're going to give you this amount of money as an income because of this, to where people are saying, well, look, I don't need to go back to work because I have this coming. So this whole thing has created a monster. You have a workforce who is now, you know, saying, look, we don't want to work because somebody's taking care of me right now, you know, within the means that I'm comfortable with. So it's kind of hard to look at this and, you know, just see any end to it because it's creating so many different mini disasters, you know, in and around this whole thing. That's what is happening. So regardless, again, to where you sit on all of this, there is some thinking that needs to be done, not no playing around. A lot of people are still playing around thinking that they're going to try to figure out how to work through the system and get over on the system without really making any real plans towards the future. You have to understand that even at some point, the system is going to say, look, we ain't handing out no more money. So whether you got yourself together or not, you're on your own. What if it gets to that point? So anybody who finds themselves procrastinating or making excuses and thinking that there's always going to be a bailout, a handout, some type of help from the government, don't sit in that seat of do nothing because you just might find yourself stuck there. Okay, I am done for now, but until next time. We hope you liked today's topic. Please leave your comments below. If you haven't already, subscribe to the channel, share it like this video, and with that, we're out. Be sure to ring the bell to be notified of new uploads on this channel, and also comment, share, like, and subscribe.